recording. Okay.
Okay, webinar has just started. I'm just going to wait for you to let people in. Okay. All right. Hi, everyone. My name is Michelle Ju, and I'm the program coordinator at Appeal. I will be your host, moderator, and also one of the panelists featured on today's webinar on youth engagement and vaping strategies and solutions. I will also be introducing our other panelists, and very grateful and thankful for them to be contributing to their presentations and dialogue discussion. So Appeal is proud to present to you a panel of experts from the Networking2Save CDC National Networks as they discuss approaching tobacco and vaping through youth engagement and strategies that affect special populations across the nation through a lens of racial, ethnic, geographic, and social health equity. Next slide. So we've actually included a slide here on all 8 of our CDC national networks. Hopefully some of our other networks who couldn't join on today's discussion will be able to join on one of our follow-up webinar sessions. So we have the National Behavioral Network for Tobacco and Cancer Control with us today. We also have SelfMade Health Network, Geographic Health Equity Alliance, and National Native Network. Other networks include the Center of Black Health and Equity, Nuestras Voces, and the National LGBTQ Cancer Network. And of course, we're here with Appeal. Next slide. So our agenda today will have some housekeeping. I'll introduce the webinar. I'm introducing the webinar right now. We'll have a presentation from all of our networks. And then we'll open it up to a short panel discussion and then a Q&A session, and we'll close with a survey and some wrap-up questions. Next slide. So this is a webinar format for Zoom call, and your video and mic is going to be off throughout the entire webinar. We ask that you have your questions for your speakers by going to the Q&A icon at the bottom and clicking to all panelists and attendees. If you have any other comments to the speakers, please drop those into the chat box. And if you have any technical questions, our technical support team, Josh and Jess, are on this call to help you. So go ahead and chat them if needed. The webinar will be recorded and will be posted on our designated websites for participants to view within about a week or 2. Thanks again for your cooperation in making this a great webinar for us, the speakers and the community. Okay, next slide. So here's our featured panelists for today's webinar. I have Samara Tamid. She's a public health professional with more than 6 years experience engaging the community and government stakeholders and advancing public health initiatives at improving community resiliency, closing mental health equity gaps, and increasing access to care. She currently serves as a project manager of practice improvement at the National Council for Mental Health and Wellbeing. In her role, Samara also primarily manages technical assistance and public health education campaigns of the National Behavioral Network for Tobacco and Cancer Control, NBHN. It's one of 8 CDC national networks established to eliminate tobacco use and cancer disparities for individuals with mental health and substance challenges. Next up, we have Dwana D. Calhoun. She is the National Network Director of SelfMade Health Network. She's a member of the Centers for Disease Control Consortium of National Networks to impact populations experiencing tobacco-related cancer and health disparities. And she specifically focuses on vulnerable populations with low socioeconomic status characteristics. Ms. Calhoun has over 15 years of senior management experience combined in corporate and state government sectors with responsibilities for divisions including public health, healthcare quality improvement, medical compliance, and disease case management, chronic disease. We also have Sarah Keller, MPHCHES. She is a public health education and communication specialist for the Intertribal Council of Michigan. She enjoys working collaboratively with our public health networks and tribal organizations. She has a passion for health equity and reducing barriers that keep people from achieving health. And she is here on behalf of Intertribal Council of Michigan and the National Native Network. Andrew Romero is the director of the Geographic Health Equity Alliance at CADCA. It's a CDC-funded national network which works closely with State Department of Health programs to reduce tobacco, cancer health-related disparities related to place. Prior to leading GEA, Andrew served as the Director of Health Policy at the Florida Department of Health in Alachua County, where he led a team with a long list of policy, systems, and environmental change accomplishments. Andrew has a bachelor's degree from the University of Florida in political science with a concentration in international relations and a master's degree in foundations of education, also from University of Florida. And finally, I'm Michelle Ju, as I said, as the I'm the program coordinator for the Aspire Network of the Asian Pacific Partners for Empowerment, Advocacy, and Leadership. It's one of 8 CDC national networks advancing health equity and uplifting efforts in tobacco-related and cancer health disparities for priority populations. I actually have I'm a public health professional with more than 5 years of experience in healthcare management, health policy, healthcare quality, safety and in-process improvement, patient satisfaction in cancer care, and disparities in work in health systems. And prior to that, I actually worked on the front lines as a medical student before joining Appeal. Okay, and now I would like to go ahead and have Samar start with her presentation. Next slide.
Thank you for the introduction, Michelle. Before we begin, I'd first like to provide a brief overview of the National Behavioral Health Network for Tobacco and Cancer Control, part of the National Council for Mental Wellbeing and otherwise known as NBHN. Through NBHN, we provide webinars, communities of practice, and many other valuable resources and information, all focusing on addressing tobacco and cancer disparities for individuals experiencing mental health and substance use challenges. For all of you on the line, please feel free to join us and visit us at www.bhthechange.org. Next slide. So I'm here to talk to all of you about e-cigarettes, vaping, and tobacco, and the role of these products on the lives of youth and with mental health and substance use challenges. Despite significant progress to reduce tobacco use and nicotine dependency among the general population, those with mental health conditions have kind of been left behind, and smoke as almost double the national rate. And we all know that vaping has rapidly become a national crisis, especially among our youth. According to the Monitoring the Future study by the National Institute on Drug Abuse, they found that vaping of all substances among high school students has been on the rise, and nearly 1 in 3 high school seniors have used vaping products in the past year. The same study actually confirmed that increasing adolescent nicotine vaping trends from 2017 to 2019 halted in 2020, which is a good sign, including a decline in daily vaping, decreases in perceived accessibility of some vaping products, as well as an increased perceived risk of nicotine vaping occurred from 2019 to 2020. So we made some progress in 2020, yet adolescent nicotine vaping remains highly prevalent, and flavors remain highly accessible, and declines in Juul use were countered by the fact that there was an increased use of other brands, including more disposable nicotine products. So a lot of policy change has happened, but unfortunately, youth have found a way to the loopholes in our policies. And again, vaping is still a problem for us. So to provide some context and dive deeper into why individuals with mental health and substance use conditions smoke and vape at higher rates, one of the things we need to do is understand the root causes of this disparity. And a lot of this disparity can be attributed to a history of predatorial practices of the tobacco industry, which include advertising cigarettes as both sedatives and stimulants. So they were basically saying that, if you're feeling sad or depressed, you can take these cigarettes to make you feel happier and pepped. On the other hand, they were also suggesting that people that are anxious also use cigarettes to make them feel more relaxed. So this was a prime example of targeting in this population, and other tactics used by the industry included, providing free or cheap cigarettes in psychiatric clinics, intentional blocking of smoke-free policies in mental health facilities, and funding of research that actually perpetuated myths that cessation would be too stressful and negatively impact overall mental health outcomes, which we now know is untrue. And I would like to bring special attention to the high rate of adverse childhood experiences, particularly for this population, also known as ACEs and trauma. Trauma in this group is, a huge issue because a lot of the folks in mental health and psychiatric facilities say that they have had previous trauma or may be experiencing PTSD from experiences they've had in their life. And as with other substances, ACEs increase the likelihood of somebody smoking early, so before the age of 18, with 21% of those with 4 or more ACEs reporting early initiation of smoking in their youth, compared to only 5.5% of those that don't have any ACEs. So if you've been thinking about ACEs and trauma and exposure and how it impacts the rates of smoking, you're on the right track. And if you haven't, you're missing a significant piece of the puzzle and the critical root causes as to why people start smoking and vaping in the first place. Lastly, individuals with mental health and substance use challenges have limited access to quality healthcare, high burden of disease, and numerous barriers to care, which makes them particularly vulnerable to tobacco-related diseases such as cancer. Next slide. So decades later, we see the tobacco industry still using the same tactics, especially when it comes to vapes. So this is actually an advertise from Juul that was pulled, and you can see a lot of similarities between the advertises that traditional cigarette companies used to pass around back in the day. Next slide. And we just talked about why huge tobacco and vaping disparity exists for individuals with mental health and substance use conditions. And while smoking and vaping is used as a coping mechanism to relieve tension for many individuals with these challenges, there are numerous other reasons why youth in particular start vaping, which are important to understand. From a 2019 survey by NIDA, it was found that 60% of youth start vaping to experiment, followed by the appeal of ends, flavors, taste, having a good time with friends. And these numbers really shine a light on the impact of peer influence and the influence of flavors on youth vaping, showing that both changes in policies and culture are important public health strategies to curb youth vaping. A separate survey conducted by the National Council for Mental Wellbeing that you'll see to the right for a campaign we did on youth substance use and message development during COVID-19 showed that during the pandemic, youth thought that tobacco products were much easier to get during COVID-19 compared to other substances, including illicit drugs. And the only substance that was even easier to access was alcohol. Next slide. So although studies on youth with mental health and substance use conditions who vape are limited, what we do know is that youth with mental health challenges are more likely to try vaping, continue use, and combine vaping of e-cigarettes with concurrent use of traditional combustible cigarettes compared to the general population at 2 to 3 times the rate. This includes other battery-powered electronic nicotine devices such as tangs, mods, puffs, and pods. The reverse is actually also true. So individuals who vape, both youth and young adults, are more likely to have mental health challenges than those who do not vape or use other tobacco products. Youth and young adults who use e-cigarettes are significantly more likely to experience mental health challenges, including reporting low self-esteem, impulsivity, anxiety, ADHD, PTSD, and gambling disorder. Next slide. Now that we know that this disparity exists and that the youth vaping crisis remains, let's talk about some resources and evidence-based practices that you all can use to address this problem. These include our tried and true practices, such as adopting screening tools, such as youth expert, also known as the 5 A's in the tobacco control world, counseling and the use of NRTs. And to learn more about screening and brief intervention for youth, please be sure to check out our Improving Adolescent Health Facilitating Change for Excellence and Expert Guide, which is linked on screen, and I believe will also be shared with you all. In addition, we have to engage youth and young adults and their support systems in conversations about the risks of ENDS use. So remember that a change in culture and youth perceptions about vaping starts at home, at school, anywhere where youth live, learn, and play, and they all start with a candid conversation. So to help you all in getting the conversation started, please be sure to explore our resource guide, Getting Candid, Framing the Conversation Around Youth Substance Use Prevention. This is a resource guide that's hot off the press and was developed this year with COVID-19 and considerations and impact in mind. And then last but not least, we should all be partnering with youth-serving stakeholders and organizations, many of you that are on the line, including those that are youth-led, to increase reach and shift the conversation from cessation to also include prevention and recovery. And I believe I'll pass it along to Dee from SelfMade Health Network.
Thank you, Samara. See, slide 12, please. Thank you. Good afternoon, everyone, and welcome to today's webinar. We hope that you learn at least one new or fun part of a piece of information by the time this webinar ends. So I'm the National Network Director for SelfMade Health Network, and our SelfMade Health Network was established in 2015. Our pillars include health equity, as well as strategic planning, community clinical linkages, tailored communication, as well as tailored technical assistance and training, and community engagement with a focus on reducing cancer and tobacco-related disparities, specifically among populations with lower socioeconomic status characteristics. And our network priority populations include low-income workers, as well as unemployed populations residing in medically underserved areas, as well as healthcare professional shortage areas. Our priority populations also includes populations with lower levels of educational attainment. For example, that may include populations whose highest level of educational attainment is a GED. And our priority populations also include uninsured as well as underinsured population. And we are guided by a leadership council that's comprised of national, state, as well as academic institutions. And the concept of self-made health, we wanted to provide everyone with information about how we were branded. So our self-made health philosophy originates from self-made health as a concept. And what we've done is we've modernized that concept so that it embraces the two major components, and one that is in the presence of affordable, supportive, and resource-friendly environments, individuals, families, and subsequently populations can attain greater awareness, knowledge, understanding, as well as self-efficacy, and an increased control in the decisions or their decisions about health risk, as well as overall health. Our self-made health concept or philosophy is also based on another item, and that is in the presence of sustained local and regional infrastructures equipped with evidence-based resources, low-income populations can make decisions that will consistently be applied throughout their entire lifespan and throughout the entire continuum of health. Next slide, please. So we also provide some historical concepts as well. So shown above is just a general depiction from the Institute of Medicine's Growing Up Tobacco Report, Tobacco-Free Report. But what's so wonderful about this model is that it shows the cumulative effect of tobacco use as teens transition to their young adulthood as well. And so this depiction is very important for two reasons. One, by the time teens transition into early adulthood, approximately 89% begin using cigarettes and 71% of youth begin smoking daily at or by the age of 18. In addition, This model also features phases or stages that are associated with the development of nicotine addiction. And those stages include the preparatory phase or stage, and that involves formulation or formation of knowledge, beliefs, as well as expectations about smoking or other tobacco products. The second stage involves initial trying, and that refers to teens maybe trying 1 or 2 cigarettes or another tobacco product. The third stage, experimentation, refers to repeated but irregular use over an extended period of time, such as smoking that may be situational. For example, that may include smoking at parties. The fourth stage, which is defined as regular use, is comprised of or relates or, is associated with teens, for instance, smoking on weekends or every weekend, or during certain parts of the day, for instance, after school, smoking with friends. And that fifth stage is comprised of nicotine addiction, or is defined as nicotine addiction, and that comprises of regular smoking, usually every day, with an internally regulated need for nicotine. And this is important because by the time a teen transitions to adulthood, they may be in the final stages and defined as regular use, a regular use tobacco user, or the nicotine addiction stage, involving either one product or multiple products. And as teens transition to their adulthood, depending on their level of education and income, populations living in poverty smoke cigarettes for a duration of nearly twice as many years as populations with a family income of 3 times greater than the federal poverty rate. What's also important to note is as teens transition to adulthood, approximately 47% of adult smokers living in poverty use menthol cigarettes compared to 36% of smokers with an income that exceeds at least twice the federal poverty level. And lastly, according to most recent JAMA report, most youth e-cigarette users first initiated tobacco product use with a flavored product, which may include fruits, menthol, as well as mints. Thank you. We just want to provide historical context, and we'll transition to the next speaker, Sarah. Thank you.
Hi, everyone. My name is Sarah Keller. I work as a health education and communication specialist for the Intertribal Council of Michigan. And I'm also here on behalf of the National Native Network. Unfortunately, my colleague, the program coordinator, couldn't be here today, but I'm happy to share a little bit about the National Native Network, as well as a vaping program that the Intertribal Council of Michigan is doing with a local tribe in Michigan. And so the National Native Network is tribes, tribal organizations, and different health programs that are all working towards the goal of decreasing commercial tobacco use and decreasing health disparities among American Indian and Alaskan Natives in the United States. And the network collaborates to raise awareness and share technical assistance for commercial tobacco burdens. A little bit about the population. Tobacco does have cultural significance for many American Indian and Alaskan Natives. And a big part of what the National Native Network does is provide culturally relevant programming for this population. American Indian and Alaskan Natives have the highest rate of cigarette smoking among high schoolers of any other race or ethnicity. And although we've seen a decline in commercial smoking among youth, e-cigarettes and vaping have presented a new challenge, and as we know, is a big issue. There is very little data for national data for e-cigarette and vaping in American Indian and Alaskan youth, but the data that we do have is pretty alarming. Next slide, please. I think 2 more. Yes, this one. Our Breath is Sacred is an social media Instagram campaign that was developed with Hannahville Indian Community, which is a tribal community located in the Upper Peninsula of Michigan. Intertribal Council of Michigan partnered with Hannahville Health Center to create a culturally relevant social media campaign. We developed social media posts and created this Instagram account to reach Hannahville youth. We also ran several ads directed towards 13 to 18-year-olds in the Delta Menominee counties where the tribe is located. We utilize culturally relevant messages such as keeping tobacco sacred, using photos that were representative of the population, as well as sharing different content from other tribal organizations and just general vaping resources. We utilized a lot of TikTok videos, and if you've worked in Native American communities, you'll know that using humor is a common way to get a message across in Indian country. And we did run some ads, as I mentioned. The one on the bottom right-hand corner with the 3 women, we actually ran into the problem of having a lot of the ads that I ran get blocked just because of a great new rule that you can't target youth with tobacco promotions, which is great, except for it also blocked my anti-vaping post. So it's one of the challenges with working with youth on social media is that it is a little bit tricky to run anti-vaping campaigns. Next slide. Before we started this project, we were able to do a discussion group with a local tribe, use the local tribal school. And so we were able to ask them a little bit about their beliefs on vaping, where they see vaping, and what social media they use, and who do they follow, and what do they use social media for. And so that's why we decided to use an Instagram campaign. It's where we learned about sharing videos and really utilizing the platforms that they already are engaged with. And so we were able to do 3 different age groups to gain their knowledge and also do a little bit of testing our messaging. Another way that we increased engagement was doing incentives, which are of course popular among youth populations. We did a couple giveaways where I boosted a post on Instagram and they had to follow us and tag a friend to get entered for a prize basket. We did Instagram story polls, just asking questions about vaping, and then just general fun questions as well to get people engaged with the page. And we did do one giveaway for an anti-vape social media contest where we had anyone under 18 submit their own social media message. And below on the screen, I have 3 examples of some of the materials that we received. And they actually got a chance to win Apple AirPods. So that was pretty exciting. We found that the incentives were a great way to engage our youth. Next slide. And then I just have a page where you can find us. Keep It Sacred has Facebook, Instagram, and Twitter. All of the resources for commercial tobacco cessation for American Indian and Alaskan Natives is on the keepitsacred.org. And Intertribal Council of Michigan can be found on Instagram, Facebook, and our website, itcmi.org. I'm also going to leave my email in the chat as well. And again, the Instagram campaign, I didn't put it on here, but it's Our Breath is Sacred on Instagram if you would like to check out that campaign further. And so I'm excited to pass it on to the next speaker and chat in the panel more later. Thank you.
Hi, everyone. I'm Andrew. I'm the director of the Geographic Health Equity Alliance, or GEA, as we're sometimes called. Our parent organization is CADCA, Community Anti-Drug Coalitions of America. Next slide, please. So we at GEA work to reduce differences in health related to place, or what we call geographic health disparities. You may have heard, as you see here represented on the slide, that the zip codes we are born in or where we live, work, and play can play a large part in our ability to live healthy lives. Next slide, please. Geographic health disparities exist because we still have system-wide problems, unfair practices, and unjust conditions that have a negative impact on the health of different places in our communities, states, and country. It's important that when we discuss differences in health from place to place, that we share good explanations of how these disparities came to be. Like, what underlying causes shape the way our neighborhoods look? Like, why do we see cigarette ads in some neighborhoods and not others? Next slide. We believe that driving many of the inequalities that we see, excuse me, we believe that driving many of the inequalities in tobacco use is uneven access to good public health laws and policies. Having or not having good commercial tobacco control laws in your state or community impacts youth initiation, smoking prevalence, exposure to secondhand smoke, successful quit attempts, you name it. And we believe that everyone deserves a fair and just opportunity to be as healthy as possible, free from the harms that commercial tobacco can cause, no matter where you live, work, and play. Next slide, please. So we at GEA and CADCA have produced a number of resources and trainings related to youth engagement. Our most recent work is based on a wonderful publication developed by the CDC that I highly recommend if you haven't seen it yet. It's their best practice user guide on youth engagement in tobacco prevention and control. The CDC basically, or the authors, draw on a number of different resources from all sorts of different fields to basically bring together I think the best aggregation of research about how to properly involve youth in public health work. We also, we have done with GEA and CADCA webinars on parts of this toolkit that you can find on our YouTube channel and website. And we've done this in both English and Spanish with our colleagues at Nuestras Voces. And I think Appeal will be sending you all the links to these resources following the webinar. Next slide, please. And then lastly, I'll say that we've also developed a number of other youth-focused webinars that you can find on our YouTube channel. So please check them out. And I've always wanted to say this on video in front of other people, but don't forget to like and subscribe. Thanks for having me here today for the discussion. I look forward to it. And Michelle, I'm going to pass it back to you.
I'm on mute. Thank you, Andrew, for that lovely presentation. Hi, I'm Michelle. I'm the program coordinator at Appeal. So Appeal is a national nonprofit working to advance health equity and to eliminate tobacco and cancer health-related disparities in the Asian American, Native Hawaiian, and Pacific Islander communities. This is especially important because, it's a vast amount of different groupings of populations of people. You have to think about the different histories, cultures, all of that vast mix. Appeal implements the Aspire network, which is what I'm a part of. And the Aspire is one of 8 CDC national networks jointly funded by CDC's Office on Smoking and Health and a Division of Cancer Prevention and Control. Our aims are to build community capacity and facilitate the development of tobacco and cancer policy. And we provide capacity building, training, and technical assistance, facilitate opportunities for Asian American, Native Hawaiian, and Pacific Islander communities to engage in policy, systems, and environmental change activities. And, we also expand and leverage media and communications opportunities to create awareness about Asian American, Native Hawaiian, and Pacific Islander tobacco and cancer issues. So some of the things that we provide are resources and tools to help organizations reduce tobacco use and cancer among our priority populations. This is access to technical assistance and training opportunities, in-language infographics and toolkits, community partnerships and collaborations, state strategy sessions and webinars and presentations. Next slide, please. We're also working with a lot of community partners, and these community partners also do quite a bit of youth work. Some highlights from recent projects: Light and Salt Association is working with their youth interns on policy and advocacy. Asian Health Services is working with a youth tobacco champion to help, and we're collaborating with them to develop a youth zine, as they call it. It's a pamphlet infographic for anti-tobacco and vaping for young people. And they know exactly, what types of pieces of information are consumable and also what they like. So that's kind of, what we're working towards. Center for Pan-Asian Community Services is working with the American Heart Association to film short videos from youth on what it means to have a smoke-free environment. And they're hoping to present that to their commissioner, their city commissioner for policy change. Our other tobacco partners include Coalition for a Better Chinese American Community, Hui Malama Olanai Oi, and National Tongan American Society, and Las Vegas Hawaiian Civic Club. Each of these also does quite a bit of work within the communities, and some of them also do youth work as well. Next slide. So why is this a problem? Vaping has become socially acceptable, according to some of the studies. So there's, a lot of challenges to prevention, such as access and availability of vaping products, use of vaping products in public places, cultural considerations, perceptions of vaping as low risk, and then marketing, which is a huge multi-billion-dollar industry, and regulatory environmental controls. Over 28% of high school students reported nicotine vaping in the past 30 days in 2019. And, as I said, advertising for products is a multi-billion-dollar industry that includes, it's estimated to be worth $19.3 billion worldwide and $7 billion business in the United States alone. Next slide, please. And for our populations, priority populations with appeal, we work with the Asian American, Native Hawaiian, and Pacific Islander communities. Tobacco companies are marketing to these Asian Americans because of high population growth, high smoking rates in countries of origin, increasing consumer buying power, and high brand loyalty to American products. People love US products, and so it's become one of those things where it's being used to sort of manipulate youth into buying tobacco products. So, we're seeing targeting of urban Asian American communities through stores, billboards, advertising in East Asian magazines and community festivals. We're looking at, at tobacco advertising. There's more in urban Asian communities compared with other urban neighborhoods. And a lot of the advertising is less likely to have health warnings than more wealthier neighborhoods. For Native Hawaiian and Pacific Islanders, there's a similar marketing strategy being deployed. Hawaii has some of the highest youth vaping rates in the nation. This is up to about 26%, or a quarter of public high school students currently use e-cigarettes. I think at least 46% have used ever in this population. Why is this a problem? Because you're seeing comorbidities and chronic disease development, which is not what you want to have develop in your community. So you have cancer, heart disease, and stroke, and these are the three leading causes of death among Asian Americans and Pacific Islanders. And all of these are caused by are caused by tobacco and smoking or related to risks from tobacco and smoking. The leading causes of cancer death in Asian Americans and Pacific Islanders is actually lung cancer. Next slide, please. So current stats on smoking versus vaping in Asian Americans. In 2019, 3.9% of Asian American middle schoolers and 13.7% of Asian American high schoolers were current users of e-cigarettes, compared with 27.5% of high schoolers and 10.5% of middle schoolers overall. Among the Asian American young adults age 18 to 24, about 2.1% were current users of e-cigarettes in 2017, compared to 5% of youth overall. And then, as I said, in Hawaii, 42% of high school students and 27% of middle school students have tried e-cigarettes or vaping at some point in their life. Okay, next slide. So, we're looking today to look at, youth engagement solutions. Youth are the target, and they kind of know, what they would like to see from themselves and what they need. They can project a powerful voice. They expose tobacco industry tactics. They can offer a good amount of energy and enthusiasm to organizations, provide generational insight, and bring fresh new perspectives and innovative ideas. What's more, they can really mobilize their peers, and they will be the future tobacco control leaders of their communities if we are able to actually build that capacity into the next generation. Next slide, please. So, that's kind of what this webinar is actually supposed to be doing. We're supposed to be discussing, how youth engagement really helps us. Anyways, find Appeal on our socials, and you can like us or subscribe if needed. Go next slide. And we'll be dropping a bunch of resources into the chat for you, but we also have some of the resources listed on our slides. Okay, next slide. And some of our resources also include digital media like Twitter chat campaigns from SelfMade Network. Next slide. So thanks for joining us. At the end of here, we'll actually have a survey, but before that, we're gonna actually open it up to the panel. So what I'll do is I'll have all of the panelists turn on their cameras, and I will switch over to the panel style of questions. I have some preset questions, and you can also put questions into the Q&A function of our screen, and I'll try and do my best to fill all your questions as they come in. All right, so thank you everyone for your presentations. It was great. Going forward, I will start off with the topic equity, disparities, and social environment. So for this question, the question is, what inequities are impacting your community priority population when it comes to tobacco control and vaping, particularly with youth? Sarah, did you want to take this one?
Sure. I mentioned in my presentation that American Indian and Alaska Natives have the highest commercial tobacco use in the United States, resulting in higher tobacco-related deaths and disease than the general population. Some I guess challenges are that the lack of representation for vaping resources, and then quitting resources as well. There just aren't that many quitting resources that are tailored to minority populations even, or American Indian and Alaska Native youth. And then the tobacco industry also has a history of targeting the tribes and exploiting the cultural significance of tobacco. The e-cigarette company Juul was found that they targeted at least 8 Native American tribes with price discounts, referral programs, in an effort to promote its products to the tribes, often trying to use, as our other panelists mentioned, as a way to quit cigarettes with vaping. And so it does get a little confusing. Especially we did here in the focus group as well. It's confusing for the youth when their parents or relative is trying to quit smoking, and then they're bringing a vape in, and so it's a confusing message.
Thank you. There was a follow-up question for you. It was, is there a way to put the anti-vaping messages on social media if yours were getting tagged? Not sure.
If yours were getting tagged, I guess just generally for social media, you can typically repost. I use like a program for Instagram, an extra app called Repost for Instagram. It's easier. I think if I understood the question correctly.
Okay. All right, that's okay. So I'll also kind of follow up with this question. So, you know, as I said, with our populations, it's really important to have like disaggregated data, and because, you know, the aggregated data really masks what's really happening within our populations. And we are also, you know, it's been found that the tobacco industry does target AAPI youth with certain flavors and also cultural marketing. So like for vaping specifically, there's like fruit, drink, and sweet candy flavors. So like things like strawberry, Starburst, custard, cotton candy, bubblegum, vanilla, Coca-Cola, coffee, alcoholic cocktails. Like who wouldn't want to try flavors like those, because it just sounds appealing. The other thing is like the Asian culture focused flavorings and marketing include things like lychee, taro root, mango, passion fruit, pomegranate, melon. And there's like, you know, there's specific like targeted messages towards these groups of people. And, you know, they're looking at things that like East Asian magazines and convenience stores and things that are just like, you know, meant for the communities are being targeted, and you know, especially like community festivals. And so those are things that, you know, it's hard to kind of like separate that. There's, you know, disparities within the groups for with like language and cultural barriers already, social risk factors, as mentioned before, with like health literacy and health-seeking behaviors and limited English proficiency within the groups. So with all of the mass marketing and targeted marketing, especially in language marketing, it can also be like, you know, really hard to sort of decide what's, you know, real information and what's just, you know, the tobacco industry trying to manipulate youth. And so that's kind of become a problem with that. Okay, so next question is, how can we address broader structural factors that are driving these inequities? And what does systemic and structural change look like? And how can we shift conversations to focus on this? And what your network is doing in the tobacco control space. I'd like to open this one up to Dee first.
Hi, thank you. Thanks. Can you pull up slide 14, please? We wanted to ensure that we had information for maybe professionals who are new to this topic, as well as those who are veterans as well. So each of our slides contains references as well, similar to our colleagues. Good. Okay. So those are wonderful questions. So we wanted to start with one important concept, and that is, as we're working with partners, we wanted to ensure, you want to ensure that everyone has a shared understanding of what tobacco-related disparities means. And so one good example is an example from the National Cancer Institute, and their definition of tobacco-related disparities includes significant differences in exposure to tobacco, tobacco use initiation, current use, and that includes poly and dural tobacco users as well. Significant differences in the number of cigarettes smoked per day, quitting rates, treatment outcomes, relapse, as well as health consequences among specific population groups. And the definition also includes significant differences in capacity and infrastructure, and that can be at a community level, at the county level, at a census tract or zip code level, as well as, and this definition also includes significant differences in access to resources. And this is important because as partners are working towards addressing these factors, it's important to develop strategic partnerships that align with this definition, but also develop tailored programming, as well as policies and mass reach health communications efforts as well to address this shared definition. But it's also important to ensure that partners have a shared understanding of what systemic inequities entails. And that could also, and that entails not only generational poverty, but from a tobacco perspective, that entails intergenerational tobacco use. And a few strategies to help address those structural inequities not only involve developing partnerships with nonprofit and community-based organizations that either provide services to populations who are disproportionately impacted, but also to organizations who may be in roles that impact major decisions related to these populations that are significantly impacted by tobacco use. And also some strategies also involve, sorry for the long-winded, but also involve addressing social determinants of health as well that are associated with systemic inequities. Next slide, please. And then as we shift the conversation to address this critical issue, it's important to not only address intergenerational poverty as a major concept, but to ensure that everyone has a clear understanding of what that entails from a tobacco perspective. And so shown above is just one example of the vicious cycle between tobacco use and poverty. And we just want to draw your attention to one important aspect, and that is, for instance, as low-income populations are impacted by tobacco products, you may have a primary breadwinner who is diagnosed with a tobacco-related condition, and as a result, they're no longer able to work. They may lose health insurance, their health insurance benefits, and as a result, the family may fall into even greater poverty, or the family may transition from a middle-income family to a low-income family because that primary breadwinner was unable to pay for the medical bills attributed to tobacco-related conditions. And then lastly, next slide, please. The final slide is just a depiction of just some social determinants of health examples, because as you are bringing in new partners, it's important to ensure that everyone has a clear understanding of what social determinants of health entails as well. And this is important, especially as you're working with youth who may have limited or lower levels of, as depicted in this model, lower levels of health literacy, lower levels of literacy, and maybe lower levels of digital literacy as well, which makes them more susceptible to tobacco marketing, deceptive tobacco marketing. Does that help a little?
That's great, Dee.
That's great, Dee. Does anything from Andrew?
Yeah. So at the Geographic Health Equity Alliance, we are particularly sensitive to how differences in public health policies from place to place drives health inequities. Evidence-based tobacco prevention, I think, is really focused on policy systems and environmental change strategies. And I think in the best examples of youth programs, we are supporting youth in becoming advocates for a policy change. So I can think of three complementary ways that we can shift the conversation. So first, youth programs have to work upstream. I think as Dee eloquently illustrated, our drivers of inequities are upstream. And so our public health programs should focus their efforts there, meaning that our youth programs should also be there and focused on policy. I think second, achieving health equity is both about process and outcome. So in terms of process, for our youth work, we have to ensure that our youth coalitions are multiracial, multicultural, and that they're representative of communities, of our communities, and that we give voice to all the groups that have been unjustly targeted by the tobacco industry. And then third, in terms of outcomes. So I spoke about process. In terms of outcomes, we have to make sure that the policies that youth and adults are championing in their work are equitable. and that the responsibility for the youth e-cigarette epidemic, for example, falls on the industry and retailers and not on youth. So we have to ensure that our policies promote health equity and do, at the very least, do no further harm. So if you haven't already, I recommend you check out the joint statement. I think my colleague Ikra is going to post it here. It's a joint statement on decriminalizing commercial tobacco and addressing systemic racism in the enforcement of our policies. I think there was a question in the chat. I was going to start answering it, but I wanted to answer verbally here. But I feel like this joint statement gives some good guidance on how we should think about equitable policymaking in tobacco control.
Thank you, Andrew. And for me, we like to look at systemic and structural change as multi-pronged and multifaceted. So it's something that, you can work from a community grassroots up to the local, state, and federal levels through programming intervention initiatives and to education and training and policy change. For us, we can, look at how we can shift these conversations by working together at each level to advocate for and empower through these pieces. And so we can look at things like data disaggregation for our populations and how we can actually get this shared information to youth and how the youth can actually, use this information to leverage advocacy pieces that they're working on within their community partnerships. We can look at policies that promotes for smoking cessation and readiness in healthcare settings, and working to empower people within the community, so the youth community, to create advocates that are working to in this space. And then looking at funding initiatives, this morning we had a conversation with one of my community partners and one of the states, and how they could look at reallocating funds for specific pieces in quit line referrals, but also how can we look at that piece and involve youth in getting that piece done, and then giving communities a voice at the local and state and federal levels. So Appeal works on a lot of different pieces, and they're all different moving pieces, and making sure that we are addressing tobacco control within the youth engagement space. A lot of it is very collaborative. Obviously, we want to make sure that youth are involved in a lot of the decision making, but we also have the adults within the community partnerships who are really helping guide what the youth are working on. And we had a few questions in the chat. I make sure we didn't miss them. Let's see.
So I was just jumping in. I think the questions were related to the fact that people were still seeing their social media posts being banned because it had images of vapes and e-cigarettes. And I believe Robin Hobart from CDC did provide a resource that they have on their website, and you can email them for the May 2021 Facebook advertising book. But I just wanted to include that this was actually a lesson that our organization had to learn as well, is that we found that using images of cigarettes, vapes on advertises, newsletters, anything is sometimes triggering for folks. So think about as if you're trying to diet, right? And you're staying away from cake, and you're seeing pictures of cake and candy everywhere. It's not really helpful for your diet. So similar, we should be, as community-based organizations, as national organizations, should be trying to avoid images that use vapes and tobacco, and instead focus on wellness, which is really the message that we're trying to get to folks. So we've been using images of people, relaxing or having fun. And this is actually something, if you look closely on a lot of vaping companies and on their advertisers, the focus is not usually on the product. It's usually on youth having fun at a party, girls together dancing, that sort of thing. So that's something that you should take a page out of Big Tobacco's playbook and kind of re-emphasize the focus on wellness.
Exactly. I mean, as I said before, vaping has become socially acceptable because it's so highly integrated within like youth culture for, going to a party, hanging out, just having a chat. Maybe they're just, outside having fun. It's it's kind of like, you know, all throughout those ads. I think we should flip it on its head and really be like, well, no, this is really not healthy for you, but here's what we can do that is healthy. And you can really actually, you know, focus on what is like good and healthy and nurturing for your body and still have fun at the same time.
Yeah, that's a great point. Thank you for bringing that up. And we did use quite a few images in our campaign that were just youth doing different activities, playing sports, and the message is like, you know, vaping is going to harm your ability to do this in the long run. And so, thank you.
Yeah. Another question, this one's for Samara. For youth in particular, vaping devices are often shared or borrowed from their peers and integrated into the fabric of youth social spheres, as kind of we were just chatting about. So what are some strategies to combat this practice?
So to provide a little bit of context, one of the things we have to understand is that the integration of vaping products into youth social spheres hasn't just been a product of youth influencing itself, but also a predatory practice in the tobacco industry, which we know has intentionally marketed to youth and has provided free products and incentives and youth social gatherings to basically make youth vapes look cool and appealing. So to begin to change the perceptions that youth have towards these devices, we need to change the culture around substance use being a mode of socialization. So this starts with letting youth know that they are being targeted with predatory practices, and organizations like the Truth Initiative and Campaign for Tobacco-Free Kids have done an excellent job of getting like the real facts out there and about the history of these predatory practices. We also mentioned the influence of peers, and just as Big Tobacco can buy out influencers to encourage peers to use vapes, we as national public health organizations can give influencers a platform to talk about the impact of vaping on their lives, to share their stories about quitting and the success they've had, and to encourage recovery and resiliency among their peers who may be having a hard time or struggling to quit as well. So aside from campaigning with the youth, we can also leverage public health campaigns that drive health behavior change by focusing on the facts that target knowledge, attitudes, and beliefs of youth towards vaping rather than using scare tactics. So an example of this is rescue agencies behind the HAZE campaign. We also have the TIPS campaign again. So Robin, I know you're on the line, and if there are any great TIPS campaigns that specifically highlight success stories of youth, please feel free to drop them in. We can get creative as well, and an example of this is like the Food and Drug Administration is harnessing the power and influence of hip hop on youth to reach out to Black, Hispanic, and minority teens who've been disproportionately suffering the consequences of smoking through the Fresh Empire campaign, which features dancers, DJs, beatboxers, and rappers. There are also many great local community mental health and social service organizations out there who really like redefined what substance-free, tobacco-free fun and socialization looks like by using their funds and efforts to provide recreational activities, tobacco-free concerts, dances, and retreats for youth. So those are also some great ways to, again, refocus the message on healthy living and thriving.
Okay. I have a couple questions from the audience. One being, what do you know about vaping vitamins such as melatonin or substances including caffeine? This comes to us from Sam Stevens.
So I think I can answer this question. I'm assuming this question is related to like the addition of vaping vitamin oil. Well, melatonin is a depressant, and then caffeine is a stimulant. But in terms of just mixing things in vapes, which I mentioned something like it's not just nicotine that's being added to these vapes. A lot of times, youth will add marijuana, CBD oils, that sort of thing. So one of the things that we always talk about is where the science is at, and you all know that before like the pandemic, the big news was EVALI, and one of the things that was found through that is that there was vitamin E oil being used to these vapes that were causing these lung injuries in people. So I would steer away from anything that says it's supposed to be an additive or substance, because like you don't really know what's in there. And for sure, if it's caffeine or melatonin that's being added into these substances, they're probably using some sort of solution to, add to the vapes, whether it's oil or another form of liquids. So we don't know the impact of it, but if anything, EVALI has really taught us the lesson that we should be being aware of these things and staying away from them.
I would like to add to that. So along with, so EVALI, for those of you who do not know, it's, the lung issues that occur when you're vaping and heating coiled. So the heating coils that heats up the cartridges, and all of that is actually inhaled into your body. And that creates a lot of lung injury, or can create a lot of lung injury, depending on what sort of substances are actually being filtered into your body through your your lungs as you breathe them in and you inhale. So for me, I would say that, again, agreeing with Samara, we don't know how. A lot of times you have to think about delivery of substances. That's why like dosages and like different medications is important. Like you can't, if you try to inject something that's supposed to be ingested, there's a lot of times like that could actually cause fatalities, because the dosage is so off from what you're being ingested. You don't get that what's called a first and second pass digestion of the chemicals that you're ingesting in your body. And the other thing is like you just don't know how your body's going to metabolize things in a different form. So I would say I would stay far away from that as well, because like she mentioned before, vitamin E oil, like vitamin E is something that's in your body, but as an oil, it's not real soluble for your body. It's not being absorbed. It's actually just, kind of collecting in your body. Anything that just collects in your body, like, if you think about like fat, sugars, all of that, that's why, with diabetics, sugar collection, bad for your body. Fat, that causes all the different like types of, cardiovascular and like lung issues. So, we don't really know like what's being inhaled and how that's being processed and metabolized in the body per se. And, those substances weren't usually meant to be inhaled in that specific form or heated to a specific form. So when you heat things, that changes chemical properties too. So I would say, that's not something that we want to move towards. I have a question here from Nora Manzanilla. She says, are there restorative, equitable, non-punitive best practices for schools to utilize for students vaping on high school and middle school campuses? Is this information webinar being shared with school districts and Department of Educations? And it's important for large institutions to have a shared understanding of and importance of equity and racial disparities in capacity building. So let's see. I guess the question is, are there restorative and equitable, non-punitive best practices for schools to utilize for students vaping on campus?
I've been commenting in the chat, but I guess I'll do it on camera. I think the resources from the Public Health Law Center are great for this. There's one in particular called Student Commercial Tobacco Use in Schools Alternative Measures that goes in. Basically, they made a conscious decision to not include any punitive measures in their tobacco control policies and discuss alternatives. So I can't remember how far in the weeds did they go into, if they go into restorative justice. However, I think it provides a good framework for thinking about what does it look like to have policies that aren't punitive in our school systems. And I'll paste that right now.
Okay. No, thank you. So we're going to change topics a little bit. So we're talking about information dissemination, cultural communication, and data advocacy. So how do we get that information? How do we collect that information? How do we get that information out to everybody? So with information and misinformation available in abundance, readily and easily accessible to the general public, how can we make sure public health education efforts for tobacco control, so that includes prevention and cessation, are more culturally humble, trustworthy, and accurate in promoting quitting? And how do we engage our community, in particular our youth, in tackling this piece? And I'll pass this one to Andrew first, and if anyone else wants to comment.
Great, thank you. So for tobacco control, and I would say, I guess, communications and marketing in general, good communication campaigns are carefully developed, tested, and evaluated. So I think in the best case scenario, when we are developing our communications campaigns, we need to build off the knowledge of the communities that our campaigns are trying to reach. Part in the comparison, but I think part of the reason why the tobacco industry is so effective in their marketing and their public relations is that they are masters in co-opting the voices of different communities to sell their deadly products. So, I think we need to ensure that voices from our different communities are authentically represented in our public health communications campaigns. And then we have to test and evaluate whether or not our messages are actually having the intended outcome that we want. So there are a number of national public health organizations that have the resources to do this kind of sophisticated communications work. So I would highly recommend taking a look at what has already been developed by our partners before starting something new. I'm very pleased that Robin Hobart is here from the CDC, posting some wonderful resources in the chat. I think tobacco control partners spend a lot of resources to make sure that we have good tested and evaluated campaigns, and I think that's a wonderful place to start.
Thank you, Andrew. And I would agree, like involving our youth communities and our within the communities that we're working with, and then like really working to make sure that we're able to help and get their input on what works and what doesn't is important. And it's also important that the voices are authentic, because we know when people are posturing and such. And so if you are able to really like get real youth voices within your communities, it's really effective that way. Okay. Next question. Lack of adequate and robust population data and research affects how we approach health in communities. Disaggregated data is data that has been broken down by detailed subcategories. For example, by gender, marginalized groups, region, or level of education. And disaggregating data can show us where aggregated data is mass discrepancies within our data pieces. So how has aggregated data harmed your communities, and how can disaggregated data help? And I'll let Dee answer this one first.
Sure. Can you pull up slide 18, please? Or this would be like just a mini course, but I think it's so important for us to, as we're working with partners, to identify innovative ways to stratify data. So a few examples would be, for instance, capturing tobacco use by age group, gender, tobacco use, including tobacco users who are poly tobacco users or dual tobacco users, but at a zip code or census level or county level as well. And it's also important to, for instance, consider stratifying data that includes tobacco use, once again, by age group, by gender, by tobacco use, but also by insurance status or employment status, and also at a zip code, census tract, or county level as well. And then stratifying that data would also allow us, as we're working with partners, to enhance our planning, implementation, as well as evaluation efforts. It would also allow us to identify maybe non-traditional partners or entities that we haven't considered that are needed to sustain outcomes, favorable outcomes. And then that also, and it would also allow us to tailor, in many instances, some of our health communication strategies so that we do impact, for instance, communities who are economically disadvantaged, maybe communities who have persistent rates of poverty, communities that have low rates of high school graduation, communities that have inadequate internet or broadband access, or communities that may be comprised of homeless teenagers who are also susceptible to deceptive tobacco advertising as well. And then it's shown in this little slide right here is just a few additional concepts to consider, but we just want to draw your attention to the tab that's labeled quantify and understand disparities. So as we're looking at data and it's stratified, if the data is stratified to a certain level, it would allow us to also identify gaps and assess those gaps so that we can maybe enhance reach and adoption of some interventions and identify which interventions are effective, which interventions can be sustained, and then also to tailor some interventions so that we do address underlying causes of tobacco-related disparities that impact youth. That's all.
Thank you, Dee. Sarah?
Yeah, I can add a little bit. Dee covered and made some great points. I guess the problem with our data is that because of problems of race misclassification, it's difficult to truly understand the burden of tobacco and vaping among different populations. People might identify themselves as more than one race, or their race isn't even on a data form at a clinic or any survey. And so, like I said, it's hard to understand like the real problem, especially since we do need programs that are specific to different communities and populations, and even grouping all tribal communities or all Indian, American Indian and Alaskan Natives together is a little bit problematic, just because these communities are so diverse based on their culture and their environment and location. That's all I wanted to add.
Thanks, Sarah. Yeah, so for me, I'd say lumping the ethnic groups together can also mean we miss nuance and we're not able to anticipate like different changes in how people are marketing to different types of groups of people for tobacco use, or see the differences in culture effects on vaping. So because the AA-NHPI group is such a vast group with like wholly different values, cultures, and history. But we are, when we are able to target groups for research, we can then look at like what, providing interventions that are effective for different communities. So my next question is, what are ways we can involve youth with tobacco health education and data gathering and dissemination? And what are some successful youth engagement strategies for your priority population? How can you and your partners tailor programming, policy, and advocacy efforts for your priority populations to be culturally, socially, and economically relevant to your communities? Samara?
Thanks, Michelle. So we know for youth and young adults in particular, vaping is being reported at increasing rates, especially among those who have never smoked before, which is pretty alarming. And this also suggests that there's like a current unmet treatment need in the mental health and substance use realm regarding vaping cessation. And unfortunately, the mental health implications of vaping are largely unknown. But available data suggests that vaping is associated with mental health challenges that are similar to traditional combustible tobacco cigarettes on the developing brain. So understanding the mental health impact of vaping will be challenging, and research is definitely needed, but research also shows us that to improve systems of care for young people, we need to hear directly from them. In order to do that, first that requires elevating their voices and listening to their stories, perspectives, and ideas. Encouraging youth voices also demands that we really equate their lived experience with valuable knowledge and expertise, recognizing that the best theories and practice just emerges from this firsthand wisdom, right? So that in and of itself is an evidence-based practice coming from a firsthand perspective. Also, the space for youth voice and lived experience should welcome all races, genders, sexual identities, and abilities. The second thing is that we should really be centering youth voices, and that requires dedicated platforms for youth to meaningfully assess, advise, and make decisions about the systems that affect them. So young people should be integrally engaged in every aspect of like their needs assessment, design, planning, and implementation of new and expanded and improved services. And all this to say that we need to be directly reaching out to youth for data gathering, education, and information dissemination. And one of the ways that we've been doing that at the National Council for Mental Wellbeing is with our Reducing Adolescent Substance Abuse initiative, which resulted in several surveys and studies. And one of these surveys, which had over 600 youth ages 13 to 18 engaged, was to develop messaging guides to engage youth specifically on the conversation about substance use, including tobacco use. In addition, we know that tailoring program policy and advocacy efforts for youth starts with putting trust and power and responsibility back into the hands of the youth. So by sharing power with youth in decision-making, and community-based organizations can empower young people to channel their voices of lived experience and create new, more inclusive approaches to improving youth mental well-being and well-being in general. So we know that meaningful youth adult partnerships across the nations are happening. They're inspiring transformational community change to build responsive community support systems that really nurture resilience, self-efficacy, and mental well-being. And at the National Council, through our Connected initiative, we're collaborating and redistributing power back to the youth through youth ambassador work groups that inform our policy and advocacy efforts.
Thanks again for your answer. That was actually a great answer. So, looking at this, we can look at it from we have youth-led programming, and identifying youth tobacco champions is really one of those things that's also important. So Samara talked about using that data, and also recruiting a lot of the youth, and that's also really important to do. So we want to have actual youth tobacco champions who lead partner projects on advocacy, policy, and data gathering and dissemination to really help communities develop the culturally, socially, and economically relevant policies that they're really working on, and also the programming that's so important for and foundational in making sure that youth are either prevented or are able to quit vaping before they start. And that's also something that's really important for educational campaigns, because that youth involvement, because they are the target audience for the tobacco industry and vaping. They also are, can effectively target their peers and identifying ways and solutions and strategies to really make sure that they get the messages out about quitting vaping that needs to happen. Successful youth strategies include developing youth leadership and giving them responsibilities and projects to input their own ideas. They bring such fresh perspectives, and they can also have a lot of energy and input from their own ideas. So we have campaigns like infographic pamphlet development from youth champions, writing and video campaigns to policymakers for smoke-free environments, and other different policies, flavor bans, tobacco compliance or in stores, and then tobacco tax increases, and zoning and licensing policies. It's important to get them involved on all levels. Some youth are really comfortable at whatever levels that they are going to be comfortable at. Some want to be heavily involved, some want less involvement, but whatever their level of commitment to the programming, it's important to get that commitment to work on those pieces. So I'm going to move to the next topic, is community and youth engagement. We sort of just talked about a little bit about that in our last question. So I'm going to go to, what are some barriers for prevention and reduction of vaping and e-cigarettes among diverse youth? Sarah?
Yeah, I would say a big barrier, as we all talked about, the marketing. Right now, the number of ads for vaping greatly outnumbers the anti-vaping messages. And even with the recent change with being able to target those under 18, it's still very prevalent. And Michelle mentioned earlier, just with the social norms around vaping, because it's really easy to conceal, and it's hard to catch as well. The teachers and parents don't really know what these devices look like, and the products are constantly changing too. So being able to keep up with just the industry and the technology that they have to conceal vapes is a big challenge. But yeah, definitely tackling the social norms and just combating different rumors about what is a vape and is it just water vapor. Those are challenges.
Dee?
Thank you. I concur with Sarah. Can you bring up slide 19? It's my last slide, I promise. But some of the consistent or persistent barriers include the ever-evolving tobacco industry's deceptive advertising practices, product development, as well as the ever-changing patterns of tobacco use among youth in various communities as well. And according to one of the most recent JAMA Pediatrics article, there's also risk of higher doses of nicotine that makes it harder for some youth to stop vaping. And within that article, it listed 4 reasons that are associated with drawing youth to use of e-cigarettes. And that includes, for instance, curiosity. That's 55% of the youth. Some of the youth indicated that they started using e-cigarettes because they received it from a friend or a family member. Once again, the variety of flavors was another reason why. Some of the youth indicated they began using tobacco, e-cigarettes, sorry about that. And then also, which is amazing, but it corresponds to the tobacco industry's deceptive advertising methods. 21% of the youth indicated that they began using e-cigarettes to do tricks, which if you notice, sometimes that's part of the advertisement practices by tobacco industries. And then also some of these reasons align with some of those initial stages that correspond to tobacco dependence. But then the good news too is that there are resources available. And so I've listed some of those resources, some of those recommendations, as well as the resources on the slide. They include one of the resources that Andrew mentioned, which is wonderful. It's one of the CDC's resources on youth engagement. But one of the recommendations that's a part of that CDC guide that I loved is listed as the 4th bullet, and that's training youth in media literacy, because it seems like we're always being reactive to the tobacco industry's deceptive marketing practices. That's all. Thank you.
Thanks, Dee. So another question is, what are some successful practices that a program can implement for policy change, and how can we approach priority populations and engage youth in strategies to accomplish this? Samara?
Yeah, the beauty of this question is that when it comes to tobacco prevention, cessation, and recovery, we know what those tried and true practices are, the main ones being screening, access to NRTs, counseling, and tobacco-free policies. But let's dive deeper on that last one of tobacco-free policies and grounds. And that one in particular can make a huge difference on the lives of youth in the settings which they live, love, laugh, and play. And in terms of getting the momentum to really move a tobacco-free campus policy off the ground, a good place to start is by forming a wellness committee. So this would also be a great way to engage the youth as well, by having them be active members of the committee and by involving them in the decision-making process. I know this firsthand because Andrew is actually on my university tobacco free committee, and I sit as a student representative, so it definitely works. And when creating your change plan and the way you'll be communicating that change in policy to a tobacco-free environment, you can get direct feedback from the youth through surveys, focus groups on what message best resonates with them. And you can also get the youth involved when it comes to building the community support and educating their peers as well. So one of the things I want to add is that for high schools, universities, and colleges in particular, it's important to recognize the role that the Student Health Services Department has to play, and getting them involved early on can really make a difference when it comes to building support, since these departments are already embedded into the institutions and the providers. They're already interacting with the students, the youth, and the young adults on a day-to-day basis. And aside from tobacco-free policies, one of the other great things you can do is to get NRTs to be distributed amongst the student health services or counseling, similar to how if you go to your guidance counselor at your university, you might see like free condoms for STD prevention, that sort of thing. And using the university's mental health counselors can also be a good asset. And many of these services are actually reimbursable as well through student health insurance plans, or the ones that the youth may be covered through their parents.
Thanks, Samara. I'm going to make one quick announcement, and then we have one more question left. So thanks everyone for joining us on this webinar. I'm so happy to have had the panelists and all the interactive audience engagement. You'll receive an email shortly after today's webinar from Linda Bosma, who's our evaluator at Appeal. She'll give you an invitation to a short survey that will help us evaluate how we're doing, and this kind of will, help with future webinar planning. So please look out for that. And information in the evaluation is voluntary and confidential. Thanks. Okay, and final question for today is, how can programs encourage youth leadership, including peer-to-peer work and sustainability in programs designed for youth engagement and tobacco control? Andrew?
All right, so I feel like that's a really big question. And so I'm going to just suggest two things that we can do, even though I think there's a lot more. But I think sort of big picture, we need to design our programs to be youth-led and adult-guided. Youth tobacco prevention programs should be aligned, as I mentioned at the very beginning, to support public health advocacy work. I think leadership comes in many forms, and I believe that the kind of brand of leadership we're building in our youth programs is that we are training the next leaders of our communities, our states, and our country. So if done right, our youth programs are going to give youth the opportunity to work through complicated societal issues, I think develop leadership skills to take positions on important issues to our communities and stand behind them, develop diverse allies and coalitions, and then in the end, make meaningful contributions to making our communities and country healthier. So the adult guided part of this is that, while youth should be leading these efforts, we really need strong advisors to support our youth programs, and in particular advisors that can carefully consider when to step back, when to step in, and advisors that care deeply about and can nurture the growth of our youth and the health of our communities. So, I again want to plug the Youth Engagement and Tobacco Control publication that Dee just mentioned, that goes into a bit more depth on leadership and sustainability. I also think that publication is in alignment with our mantra here at the Geographic Health Equity Alliance and CADCO, which is that our youth programs should be youth-led and adult-guided.
Thanks, Andrew. I don't think I could have said it better. So yeah, somebody had asked earlier about different age groups and under 18. I believe I also pointed them to the best practices guide for youth engagement. It's very well written, fairly easy to read, although, a little bit longer than what I'd want, but it has information about how to really, from start to finish, recruiting youth, also leading youth, when to step back, when to take the lead and really be the guiding piece, and making sure that the youth are aware of what their strategies are supposed to be and what they can really bring to the table. So today's panel was really about how do we really bring the youth to the forefront and making sure that tobacco control is something that's really on their minds. Any closing comments? Okay, well, thank you everyone for joining us. Again, we're sending out that survey, and we're so happy to have had you for the last hour and a half to just talk about tobacco and vaping and youth engagement. And a hand to all of our panelists. I wish they could hear you clapping, but they've been great. Appreciate it. All right.
Thank you, everyone.
Thanks, everybody.
Thank you.